I saw a fellow who's an ambulance driver in a remote community in Papua New Guinea, and his vision was terrible. So he said, yeah, it's dangerous. I have a hard time driving because my vision is so poor. They couldn't afford the glasses because they're often $500 or something. That would be like 6 months' salary for most people, or even more. It's just completely unaffordable.
Welcome to Multiple Hats, a show about STEM professionals who have gone off script and carved their own path beyond the tracks that were set for them. Science, technology, engineering, mathematics, medicine, how they found their why and what it takes to make it happen. I'm Angelique, and on the show today, I'm talking to Dr. Sarah Crowe, the founder of OOXI Global, amongst other businesses, mind you. OOXI glasses are not just glasses. They are a whole new simplified paradigm around eye test, prescription, and access to glasses. And you want to hear about the name because it's not an acronym, it's better than that. Sarah is an adventurous Canadian ophthalmologist with over 20 years of clinical practice who loves a good challenge, and you can tell from her early career, moving to South Africa in the middle of apartheid, working as a junior doctor, confronting the unspeakable inequalities while expecting her first child. With her first experience in entrepreneurship, running her own ophthalmology practice, and fast forward 4 grown-up kids, Sarah took the road again, this time to the Solomon Islands, where she was struck by the simple fact that people go around with little vision because they cannot access or afford glasses. If you listened to last month's episode about UNSW founders, here is a direct example of what the accelerator can do, including helping with lenses and glasses design. Get ready for Sarah's life story of adventurous moves driven by social impact, a dual business model enabled beyond the nations, and one of my favorite combinations of simple and effective. Let's hear it from Sarah.
I'm Sarah Crowe, founder of OOXI Global.
And Sarah, could you give me the current company pitch? So where are you at this moment?
1 billion people in the world are visually impaired simply because they can't access glasses. My mission, and the mission of OOXI, is to make glasses accessible to all. Currently, the way you get glasses is by going to an eye health care professional and getting a prescription. The prescription is sent to a manufacturer. You get the glasses a week later, and it costs a lot of money. None of those things are possible for people living in remote and low resource settings. And so I saw this problem firsthand when I was working in the Solomon Islands and decided I needed to try and help solve this issue and get glasses to people who need them. Over the last few years, I've developed what I call the OOXI Vision Kit, which contains everything a basic health worker uses to test vision, check for the need of glasses, and dispense customized glasses on the spot at an affordable cost.
All right. So you say 1 billion people can't see very well, as in blurred vision.
Mm-hmm.
And so how do they function? So you said you've seen them firsthand. How do they function in this country where they don't have glasses?
They don't. That's the problem. Or, for example, I saw a fellow who's an ambulance driver in a remote community in Papua New Guinea, and his vision was terrible. So he said, yeah, it's dangerous. I have a hard time driving because my vision is so poor.
And no one has glasses there. It's like a luxury product.
No one. They don't have anywhere they can get them except going to the capital city, which for most people is impossible anyway. And even if they went to the capital city, they couldn't afford the glasses because they're often $500 or something. That would be like 6 months' salary for most people, or even more. It's just completely unaffordable.
Why? What do you think is the opportunity cost, as in them not being able to function? What do you think? So if 1 billion can't see and function properly, what would the estimated opportunity cost for this loss of work estimated around the world? Do you have?
Yes, the World Health Organization has estimated the annual global economic burden of this problem to be $647 billion US. It's enormous.
Okay, so 600 billion. And we having glasses that are going to cost $500. So yeah, if you make the math, that would still be highly beneficial.
Yes, but we can make glasses for a fraction that cost, make them affordable for people. Yes, that's the goal.
Okay, so what's the cost for them now with that OOXI?
We're still developing the system and the manufacturing process. So we're hoping to get them to below $10 for a pair.
Wow.
At the moment, it's about $12 to $15, but we're working to reduce the cost.
Okay. That sounds fantastic. We're going to go in depth on where you get to that. But before we do that, can you tell me what is your anchor to STEM? So you started with biology, then you did physiology, then molecular biology, then medicines, like quite a long academic, like lots of university.
Yes.
Can you tell me a little bit like how you went through those choices, navigate your uni years, and in the early career?
Sure. I grew up in Montreal, and in Canada, medical school is a postgraduate degree. I was thinking I wanted to do medicine. So I did the first degree in science and liberal arts as well. I did English and philosophy and all kinds of other things as well. But I didn't have any money, really. I left home when I was 16 and had to basically pay my own way. So I had to rely on scholarships.
Right.
I got a Rotary scholarship to go to Scotland for a year where I did my honors year. And then I got a scholarship the Rhodes Scholarship to go to Oxford to do a doctorate. So I basically just went with where I could find funding.
So you started with the bachelor in biology and then the honors in physiology in Scotland. And then the PhD in molecular biology at Oxford. Why molecular biology?
Good question. I haven't really thought about that. I just enjoyed biology, and I'm not really sure why I chose it. It just the opportunity came up to work in a molecular biology lab, and so that's what I did.
Yeah, and how did the opportunity came up? I like the opportunistic approach, but how did it come up? How did your universe send that your way?
I won the Rhodes Scholarship, and then you have to find a place to do your doctorate. And so I just visited a few labs and saw what projects were going on and just decided to try that one.
Okay. And what was the thesis subject on the molecular biology PhD?
The differentiation of bone cells and the development of bone at the molecular level.
Awesome. Okay. Yeah. I like it because at the end of the day, often we make it look like it's been very thoughtful, but when we're young, we're not that thoughtful. We just go with, you gotta take opportunity and see where it takes you and then get it this way, right?
Yeah. There was no thoughtful planning at all. It's just like I followed my nose.
And that's perfect. Look, it took where you are. And so after that, this is when you decided to do med school?
Yes, I went back to Canada to do medicine and spent 4 years there and then did my internship, and I worked for 6 months in locums doing GP practice and so on. And then by that time I was married, and so we decided my husband is also a Rhodes Scholar, and we met in Oxford. And a lot of the sort of discussions at Oxford were around apartheid in those days because it was a big issue. And the South African people we knew always said, you don't know what it's like because you've never been there. That was always how the conversation ended. So we said, okay, we'll go and we'll find out. So we lived there for a year and worked in a hospital there. And it was very instructive. It was a good learning experience. I wouldn't say it was enjoyable, but it was a very good experience. And our first child was born at the end of that year in Africa. Yeah.
Wow. What a great move. And so what was you say it wasn't enjoyable, but instructive. What was your takeaway? What really shocked you and take me through it.
Oh, apartheid was shocking. Just going places where Black people weren't allowed to go. And we worked in a hospital where most of the patients were Black, and they would often be subservient and almost childlike, the older people, at least in their attitude. And if you went to shake their hand, I remember one time, I always shake my patients' hands, or before COVID anyway. And there was this really tall, muscular Black man who was in his 30s, and I went to shake his hand and he shirked. as if I was going to hit him or something. And I looked at him and like, what did you do? And we both laughed in the end, but I just thought that was his first reaction, is that I'm this white lady and I was about to hit him or something.
Oh, this is heartbreaking.
And there were so many incidents like that. And you just thought, this is so ingrained in people.
Yeah, they've been traumatized.
Yeah, another time there was an older man had been admitted for diabetes, which was then under control. And he wanted to go home for Christmas. So I sat and talked with him for a while, and he wanted to go home. And there was this diabetes educator lady who was an older Afrikaner woman. And I said, I think Mr. Crowe is okay to go home for Christmas. And she said, no, he doesn't understand anything. There's no way he can go home. And he said, he doesn't understand about diabetes. And I thought, okay, that's a bit weird. So I went back and spoke to him. And I asked him, what's diabetes? How do you look after it? How do you do your insulin? He knew everything. And then at the end, he said to me, who's that older lady who keeps coming in and yelling at me?
Okay, so that was just like pure bias.
She just assumed he was stupid.
Oh, wow. Interesting.
One other story I'll tell you is that I looked after a lady whose last name was Van der Merwe, which is a very common name in South Africa. And I was told to make an appointment for her for follow-up in the outpatient clinic. And I phoned the outpatient clinic and I said, I'd like to make an appointment for Mrs. Van der Merwe. And they said, well, is she colored or white or black? And I said, she's beige. And they said, I need to know what she is because we see the colored people on Wednesday and the white people on Tuesday.
Oh my goodness. Yeah. So it was like full on apartheid.
Yeah.
Yeah, of course. And well, my generation doesn't really know that. So it's gold that you get to tell us, because history reproduces itself many times and we can't say that Black people have it equal everywhere in the world anyway.
Absolutely dreadful. And if you had a Black patient who has an African name, of course, the white doctors would often just call him John or just not even recognize his name or even try to pronounce it. And when I would try to pronounce their name, and sometimes we would have a laugh over it, but at least they knew that
you were trying. Yes. Yeah.
You were treating them like a human being. It was things like that happened all the time.
So you lasted a year, and then was it too much traumatic or?
Yeah, no, we planned to stay for a year. We had a year's job. But by the end, we were glad to leave. Yes.
Yeah. Okay.
And the other thing that was funny is because I was pregnant with my first child, I was very pregnant, 8 months pregnant. I was still working on the wards, but the nurses in the hospital, who were mostly Black people, they couldn't believe that I was waddling around the ward being so pregnant, because in South Africa, the white women would just sit with their feet up and be served while they were pregnant.
Oh, yeah.
They're not used to women working to their pregnancy. The whole thing was quite bizarre.
So junior doctor, and then when did the ophthalmology work come?
After South Africa, we came back to Australia, and I decided I wanted to do ophthalmology, but by then I had one baby, and the entry exams to ophthalmology are quite difficult. So I had to take some time off for that and time off to spend with the baby. And then I had a second baby. I was basically off clinical work for 2 years. I stayed home full time, looking after the kids and studying for my entrance exam.
While looking after the kids?
While looking after the kids. So I had 2 years off clinical studies, and then I did my exam and I went back to work when the second baby was 9 months old.
Wow. Yeah. Okay. I know that many people think that maternity leave is very relaxing and you've got a lot of time, but I do know it is not the case at all. You A, not sleeping. B, in between feeds, you've got no time really, because that's what? One, by the time you've washed all the bottles or whatever you need there, you literally have no time. But you managed to do in these 2 years with 2 babies, let's emphasize that, to study to the exam for ophthalmology, and then went back when he was 9 months. So that's quite an achievement. When you have so much work and sleep deprived, What's your trick, or how do you make everything fits and still do quality work? Because obviously you passed the exam, so what you studied stayed in your mind. Yeah, how do you handle that?
It's not easy, but I think the trick is to just focus on what you really need to do. Focus on the important things. So prioritize, especially in terms of studying. Study the things that are most likely to be asked on the exam.
And how do you know that?
Oh, just from past exams and speaking to people. And also, I guess with having to look after the kids, you have maybe an hour. Maybe you hire a babysitter for an hour or two. And so I've got this time that I have to cram as much study as I can into the time. So you don't have the luxury of just coming and going with your study like you do when you're single. You have to say, okay, I've got this short period of time. I've got to make the most of it. I've got to study the things that are important and get as much done in that time as I can. So it's actually good in a way that it focuses you and just makes you more efficient and do what you can. But like you say, the main thing is you're so tired.
Yeah. Yes. And we know memory is very impacted by sleep deprivation. The baby brain they say that because of hormones, but it's not just hormones. It's just sleep deprivation. Yeah. All right. Well, so people, you can do the most of your maternity, but I don't want it to be a standard for everyone because you can also sleep through your maternity leave. It's okay.
I should also say, of course, I could never have done it without my husband because he helped look after the kids. He make the dinner, does the housework. He helped a lot. I could never have done it without his help.
Okay. It was shared housework and all that.
Yes.
Yeah. Okay. Yeah. That helps. Did you have any parents help or?
Oh, no, I had no family of my own in Australia. They are all back in Canada, but my husband's parents were very supportive. They would help with babysitting sometimes. Yeah. They live nearby. Yeah.
So it takes a village, but still very impressive. So fantastic. Okay. So then 2 babies, get ophthalmology work. So you started in 2000 working as an ophthalmologist and you did private practice.
Yes. There's a little bit in between there because I worked full time for 2 years. And then I had my 3rd child and I took a year off because it's hard to take just a few months off, or it was in those days anyway, because nobody really took maternity leave then. So I decided to take a whole year off, firstly to make it easier for them to replace me for a whole year and also to study for the exit exams, the specialty exams to finish your ophthalmology training. And I knew with 3 babies, it was going to be difficult. So I took a year off to study for the exam and look after the kids. And so then I passed the exam. And then after you finish the exit exam, you can do a fellowship overseas. We went overseas. Our 4th baby was born 3 months before we went overseas. So we went to live in Calgary in Canada for a year and had 4 kids. And one of the main reasons for going there was so that I could teach my children to ski and skate.
That is a great objective.
I was happy for them to be Australian, but they have to know how to ski and skate.
And do they? The 4 of them?
They're very good skiers and skaters. 2 of my sons played ice hockey in Australia. One even went to the World Championships in the under-18s in ice hockey.
Oh, wow.
So he was on the national team.
You achieved a goal there.
Yeah, and they're all good skiers. Then after Calgary, we came back to Australia and I started my practice. That was in 2000. Yeah.
You started your own practice?
I started my own practice, yes. And the reason for that was I didn't want to be too busy at the start with all the kids and everything. So I thought if I start my own practice, it will just grow slowly and I can take enough time off to enjoy the family and look after them.
Yeah, so that's a little bit of entrepreneurship already, right? Because suddenly you have to do everything. So is it easy to start your practice? Is it just as easy as finding a place, or is there a lot of difficulties around this?
No, of course, there's lots of difficulties and lots of financial costs to set up all the equipment and hire people and get things and rent a space, all those things. It's a lot of money. And when you have no income to start with, it's a big risk. But you've probably figured out by now I'm a risk taker.
Yeah, going across the world. And so
Yeah,
definitely that forged resilience. I think it is actually a good point, because I think traveling and having to adapt to lots of different cultures and all that gives you skills that you wouldn't if you stay in your bubble and you live at your parents until you're 30. And
absolutely.
It's great to save to get a first down payment, as this is what people in Sydney do, but it's not as character building. So going around definitely is character building. It gives you skills.
Great. I also think it gives the kids skills because they were experiencing that at the same time. Like when we first moved to Calgary, one of our kids said, can we go to a playground? And we said, okay, we don't know where the playgrounds are, so let's look up on the map and find a place to go. And they learn how to do that as well. It's not just laid on. You have to find out, and you have to try something new, and
maybe it doesn't work and you find something else. And absolutely. Yeah, that's great.
I remember one of my sons went to his primary school. He was in kindergarten. He took his prized rugby ball to class because he was trying to make friends, and he would share this with his friend. And of course, they didn't know anything about rugby. And he came home so upset because they weren't interested.
Oh, no. Yeah, it's hard to make friends. When my son meets new people, he's like, I don't know their name, Mama. I can't make friends.
Yeah.
And I'm like, you just go walk up to them and ask and say, my name is Star. What's your name? So it can be hard for kids. But as you say, they learn. Every kid is different, right? So some are going to be better at doing that than others. But
absolutely. Yeah.
I think some people worry that once they have kids, they can't do anything like this, that they have to get them and settle and have them for 15 years in the same place.
Yeah.
And there are advantages to that, but there's also benefits into the other way.
Absolutely. I agree with you 100%. And a lot of young people think they have to be settled and have a house before they can have a baby. But that's not true either. When we had our first one, we were backpacking, basically. You just make do. Babies don't need anything much except a little pouch to carry them around in.
And their parents around. That's really what they need.
Yeah, that's all. You don't need any fancy equipment or fancy prams or anything like that. So.
Yeah, when you're in a bubble, you don't see that because you see all the people in the mums group having all the fancy prams and everything and having the nap gel and things like that. And then, so you think this is the only way unless you see something else. So it's a good thing to say, right? So I'm really liking getting through that part. I think it's interesting also to talk a little bit about setting your own clinical practice because not everybody does. How much does it cost to start a clinical practice? You said equipment, hiring a few people. I imagine a receptionist and maybe an assistant. And the room?
I think I borrowed about $400,000 to start.
Up front. How many years does it take you to be sustainable there?
Like I said, I built up slowly because that's what I chose to do. I would say at least 4 or 5 years.
Okay, reasonable though. Reasonable. Yeah. And then you covered that cost and then you're sustainable.
Yes.
Thank you so much for that bit. So then you work on all this. And then what was the pull to entrepreneurship to start OOXI then? Mm-hmm. When you said you went to the island and all that, so when did that happen?
Yes. My husband is a professor of surgery and he's interested in medical education. So over the years, he's done a lot of work in various developing countries, helping develop medical curricula and helping with surgical training. So he used to go off on trips every now and then to these places and I was home with the kids. But I've always wanted to do work in the developing world ever since the year dot. But I put that on hold. We were having kids and everything else. So when all the kids left home, he was going to the Solomon Islands again for a usual trip. And I said, I'd like to come and help out, but there's not really enough time to organize eye clinics and cataract surgery and all that sort of thing. It's all a bit complicated. So I said, I'll just come with you. I'll help you at your surgery and I'll do some maybe help in the eye clinics and just get a feel for what goes on there. And that was in 2017.
So 20-year practice and you take the road again.
Yes. We went there and I helped out in a clinic. There was an eye clinic run by a nurse at the hospital. And I spent some time there and I realized that's when I really had a big wake up call because there were really no facilities, almost nothing. There was no medicine. There was no surgery. except for the teams that came in from other countries for a week or two to do surgery, and then they would leave again. So it was quite confronting that this eye clinic was there. All these people were coming into the eye clinic with problems that I couldn't do anything about. But I saw that almost all of them who came to the clinic could have their vision improved with glasses. So I said to the nurse, I noticed there was a testing instruments there for testing for refractive error. That means what blurred vision that can be corrected with glasses. I tested this big Islander security guard, this big, strong guy. I tested him and I found out he actually couldn't see much at all and he needed really thick glasses. So I said to the nurse, this fellow needs glasses. Here's a prescription. Where can he go? And he said, oh, no, you can't get glasses here. And I said, what do you mean? And he said, there's nowhere to get glasses on this island. And the only place he can get glasses is to go to Honiara, the capital, which is a 4-hour boat trip away. And nobody goes there. It's not possible because even if they got there, they couldn't afford anything when they got there. So nobody goes. So I said, okay. I said, surely there must be a way. He said, there's a box of secondhand donated glasses in the cupboard. You could have a look there. So I went to the cupboard and this box of secondhand glasses was covered in dust and I could see it hadn't been opened for ages. But being the determined soul I am, I started rummaging through these used glasses and eventually came up with something that was a little bit quite close to what he needed. But they were these pink Dame Edna sort of glasses. I just thought, this is ridiculous. There's no way this big security guard is going to wear these pink Diamante glasses. And that's when I just thought, this is ridiculous. We've got to do something about this.
Okay, so you did a full-on customer discovery, step by step, on the spot, like no brainstorming in a white room. It was like walking the way.
And then I asked the nurse he was checking for refractive error as well. And I could see that although the equipment was there, he didn't know how to do it. I could see that he wasn't really competent in it. And I started looking into this problem. And that's when I found this figure. 1 billion people are visually impaired because they can't access glasses. And this is exactly what I saw in the Solomon Islands. And I thought, this is ridiculous. We've got to do something about this. So that's when I started. And it's been a long road since then, but I'm very bloody minded. I'm determined. There are a few problems. One is that you currently have to see a professional to get a prescription. And there just aren't enough professionals in the world to see everyone who needs glasses. And to my mind, it's like saying you need to go to a podiatrist to get a pair of shoes. There aren't enough podiatrists. And people just need a pair of sneakers. They don't need orthotics. They don't need something really fancy and expensive. They just need something that will allow them to function. So that's the analogy I use. Obviously, everyone needs eye health, and we have to aim for that. But in the meantime, it shouldn't be that people are deprived of functional vision because they don't have access to an optometrist. I'm not trying to undermine optometrists in any way whatsoever. They do wonderful work and the outreach they do is great. But there's not enough of them to go around, and their glasses, the way they're currently made, are too expensive. So this is why I came up with this system. Basically, the method for testing for refractive error hasn't changed in 100 years. It's unnecessarily riddled with jargon and difficulties. So one thing I've done is just simplified the whole thing down and made it more intelligible to a layperson. So getting rid of the jargon, getting rid of the things that make it a little bit complicated, just making it simple. Then the glasses are designed so that they can be customized for anyone. They're stainless steel, so they're very durable. They don't have a screw in the hinge, so that's always the first thing that breaks. They're very durable. I've had my own glasses for 5 years. And adjustable. The lenses are round so that you can adjust them to any size Astigmatism is a type of refractive error where the eye, instead of being round like soccer ball, is shaped more like a rugby ball. So there is an axis to this shape. And in order to correct that, at the moment, you need customized glasses. But ours is the only low-cost system that can correct astigmatism because the lenses are round and there's a protractor etched on the inside of the frame. So you can adjust the lens to the axis of the football shape. And although astigmatism isn't that common in the general population, maybe 15%, it's quite common after low-cost cataract surgery. So there's a lot of people out there who have had low-cost cataract surgery in developing countries and end up with astigmatism, refractive error. So they're not getting the most out of their operation, if you like. They're not getting the best vision.
I have a few questions there. Number one, why are glasses expensive in the developed world if we can simplify it so much? Number two, how are people getting cataract surgery if they can't even get glasses? Let's start with question number one. So you obviously simplify the process a lot in the simple detection already. So that's one thing. But then in the second bit of doing durable glasses that are customable, and you're saying we make them very expensive. Why are they expensive in the developed world if we can make them cheap and still effective?
It's not really the glasses that are expensive. It's the way that we get them. Getting a prescription from a professional, obviously the professional needs to be paid, and the professional provides an excellent professional prescription. So that's great. But then we have a choice of frames, branding. You can buy a high-end frame by a designer, which will cost more. So some of that's branding, but it doesn't necessarily have to be that expensive.
Okay, so it's really all the fancy feature that we like, and the anti-reflection and the anti-scratch and the second pair added. It's why we have iWatches instead of analog watches.
I would say it's a difference between a smart watch and just a plain digital watch you can get for $10. You don't need all the features of an expensive pair of glasses necessarily if you just want to be able to see more clearly.
Yeah, okay, understood. So we take rid of that. And then the second question, I was quite surprised because you said there is no access to get glasses and optometry, but they can get low-cost cataract surgery.
No. Some people can get cataract surgery. It's still a small number compared to the number who need glasses.
Okay, all right.
So I'll give you an example. When I was in Papua New Guinea in a village there, I saw quite a few older people who have cataracts. They are never going to be able to get cataract surgery. But when cataracts develop, it often makes you more nearsighted. So there was an elderly man there with quite bad cataracts who couldn't see the biggest letter on the eye chart. But when I gave him glasses, he could see reasonably well, much improved. It wasn't perfect, but it was much better than what he had. And he was never going to be able to get cataract surgery. But there are a lot of organizations who go to places like other countries to do cataract surgery camps, and they do lots of cataract surgery in one go. But those people don't get glasses necessarily, or usually they don't get glasses because they're not followed up. So that's one thing I really want to do in the next year or so, is to study people who have had low-cost cataract surgery and document how much more we can improve their vision if we give them a pair of glasses. So that you could say then, if a foundation pays for cataract surgery, say they pay $150 for a cataract surgery, why not pay $160 and actually improve their vision 30% more, or whatever the figures might be?
Yeah, so partner with the mobile cataract surgery.
Exactly.
Oh, yeah, good.
Yeah.
And the comment I wanted to make. So when I talk about entrepreneurship with people, it's a lot about groundbreaking technology, research, innovation, and we'll go into the innovation part of your process because I can sense that there is more to it than just putting a pack together, of course. But you saw problems where a solution already existed. It's glasses. So sometimes it's just applying your skills and saying these skills exist. The solution is there. we simply have to deploy it where it's not deployed already. So it's not always about going to Mars, but being there to make the impact where it needs to be done. So I really want to reemphasize that message, because I think a lot of people get blocked on finding something new when you can make such a difference with what you already have and what you already know if you know where to apply it.
Yes. And sometimes the best solutions are very simple and inexpensive. I had the pleasure of hearing Dimitri Tran, who's one of the mentors at UNSW Founders. And he is a guru of AI and health and lots of high-tech stuff. But he's done work in Vietnam, and one of the things he did was he noticed in the hospital they have oxygen tanks that are taken out in ambulances and things, and the oxygen would sometimes run out and someone would die just because the oxygen tanks were empty. So he made a simple system where the tanks are stored. He put green electrical tape on one square of the floor where the oxygen tanks were full. Red tape on another part of the floor where the ones coming back, empty ones, would be stored. It costs a few dollars, but it saved numerous lives.
Very simple.
The point is, it's not necessarily the innovation, and the entrepreneurship doesn't necessarily have to be some very fancy, clever, expensive thing. It needs to be someone looking at what's going on and saying, it doesn't need to be that way. There's a better way of doing that. And often the better way is simpler and cheaper.
Yeah, the simpler the better, that's for sure.
Yes.
Yeah, and that's what we see sometimes with NGO, well-intentioned NGOs that goes and donate stuff that then will break and then there will be no use. So they use for 6 months like incubator for babies in Africa, and they're so expensive to maintain. And then they did a little lamp that is literally done with a car battery and a car lamp, and that works just as well, but they can be maintained.
Exactly. And this is what our Vision Kit allows, is people to do it after we leave. We can supply the kit and we can teach them how to fish rather than giving them a fish.
So that was my next question. How do you get the buy-in for the community? How do you get into there? And also, did you find that you had to go... Is there any of the white savior narrative into there when you go into this country and here's the white people coming to teach you and do things differently?
No, that's just not our way. I've been very lucky to have the support of the Kokoda Track Foundation in Papua New Guinea, and they've supported the whole development of this from 2018 to the present. So I wouldn't never have been able to get this far without them. They do amazing work throughout Papua New Guinea in health and education.
They're local?
They're based in Australia, but they work in Papua New Guinea. So basically, we tapped into their network of community health workers. And I've been there a number of times to train the local community health workers to do the system. So I think that's one of the reasons it's successful, is that the people who are being tested, who are having their vision tested and having glasses made, are being looked after by their own community members.
Right.
So if I go and test the vision and I say, is it better or worse? And they say, yes, doctor, because I'm a white old lady.
So they wouldn't give you the truth.
They just want to be polite, and so, or maybe they don't understand what I'm asking. So then when someone speaks their own language and is someone they know in the community, I hear them yabbering away to each other and having a laugh, and I know that they're getting the real answer.
Okay, good. Yes, so really leverage.
And all I'm doing is teaching them how to do it so that they can continue the whole process after we leave. I mean, the Kokoda Track Foundation is the one doing all the training and so on. It's definitely not a white savior program. It's let's bring this to people who can do it and continue. And we're trying to make ourselves redundant.
Beautiful. I love it. No, that's great. Now, tell me something. When these people who have spent maybe 20, 30 years not seeing well get their first glasses, what's the reaction?
It's amazing. that's what keeps me going, and they put the glasses on and there are a few different reactions. Sometimes they cry.
Oh, yeah, I would have goosebumps.
Sometimes they laugh. And sometimes their jaw drops and they just look out into the distance and just look around. Like, it's amazing.
So much beauty around.
It's what keeps me going because the impact is so profound. And it's also why the local people want to learn how to do it because they see such an impact.
Yeah. Yeah, that's amazing. Social impact.
Thank you. Yeah, we're so determined, but funding is the main problem we have. We still have no funding, really. We have some bits and pieces along the way that keep us going. And thankfully, Kokoda Track Foundation continues to support us. But what we really need now is investors so that we can manufacture at scale to get prices down. And we also need to hire people because at the moment, it's really just me doing everything. There are lots of people helping me pro bono or with a little bit of pay, but we really need to hire good people to set up operations and.
Yeah. Okay. So we're having issue with fundings, which obviously is always talking about that. Okay. So you've been doing that for 5 years. What's the cost associated with that whole project? More or less, roughly.
Oh, I'd say about $500,000 so far.
Okay, so $500,000 so far, and you got some money from NGOs?
Kokoda Track Foundation, and then the rest is just from us, me personally.
Okay, so self-funded a lot. So if we want to talk to investor, and I know that social impact is what we really want to go for, but investors are probably going to look at return on investment. So when you look at your business model, can you take me through the part that obviously you want to have locals for the developing world who cannot afford $500 glass, but what's the sustainable model for it for an investor to look at?
Yes. When I started wearing my glasses around, it was the first time in my life that people came up to me in the street and said, "Where did you get those glasses? I really like them." And that's when I thought, I can sell the glasses here at a higher margin and use that money to get the glasses to people who need them. This is one of our models. We plan to launch a crowdfunding campaign soon, and we're almost about to open our new website, which will have a shop associated with it, so that you can order our glasses online, including putting your own prescription in, and we can send prescription glasses. We've got sunglasses, we've got accessories like glasses, bags, and things. So we're hoping that will be one income stream to help us. And I must say, I am a great admirer of who gives a crap. Toilet paper.
Yeah.
And so this is how we model ourselves. 50% of our profits will go to our foundation. So we have an associated foundation called the Four Eyes Vision Foundation. And that's what supplies glasses to the needy communities. So OOXI will sell glasses direct to a developed market. So Australia, UK, North America, wherever, to hopefully raise some money to keep us going. But we will also sell our vision kits to people who can afford to buy them. So there are lots of places, for example, India or other cities where they can afford the true cost of us manufacturing this system. So that way we can hopefully make it financially sustainable. We can support the foundation to get the system to people who need it the most, who can't afford the cost of production.
Sounds really good. Yeah. Is there any fashion brand like Dior or that would be interested in partnering, or is that a silly suggestion?
I don't know. We'll leave that out there on the ether and maybe they can contact me.
Those big brands have, I don't even want to look into their margin, but they know how to make something a trend, or I don't know, an influencer or something like that.
Exactly.
And then they could sell those, yeah.
That's what we're looking at doing. But again, we need people to help with that, especially branding and marketing. Like you say, a lot of it is that. People spend a lot of money on bottled water when you can just drink it from the tap. We need branding people who can say, this is what you really want. And I should add, our glasses won the Good Design Award for social impact last year.
Oh, right.
Australian Good Design Award. We're very proud of that. Hopefully that will help us.
So how does it look like? Round glasses?
Yes, show you the round glasses. We've got 4 colors: bronze, gold, silver, and black. They're round so that the lenses can be turned around. So you see there's a protractor etched on the inside there.
Right.
And they're stainless steel, so they're really durable. They don't have a screw, so they have a special hinge there that doesn't break. And you can adjust the size by adjusting the arms around the ears and adjusting the nose pads. You can adjust the curve of the nose bridge if you need to bring them closer together.
So smart design, light design, durable design.
They're very light, yeah.
And very adjustable in a very easy way. So you don't even have to go and get your glass tiled again several times.
That's right. Exactly.
Yeah, no, I love it. Okay, the solution is simple. And yet there is a lot of development going into that.
Yes.
So can you tell me a little bit more about the tech development, prototyping, IP, manufacture, scale up?
Yeah, it's all about tech making things simple. In some startups in the digital area, at least, they call it barefoot technology. By using technology, we can make it simple enough that anyone can use it. So that's part of the thing. Associated with our testing wheel, we have a mobile app. And the mobile app can be used offline. And it gives step-by-step instructions. A lot of the difficulty with testing for refractive error is that when you write out everything that needs to be done, it's overwhelming. So you say, okay, well, if this happens, you do that. But if that happens, do that, and so on and so on. And it all seems overwhelming. But when it's in an app, the app guides you down the path you need to go. So the app says, click on which is better, and that will take you to the next instruction, what you have to do next, and so on and so on. It's all simplified, and the person just needs to follow the instructions. And the rule is never give glasses unless they improve the vision. That's the whole point. It's subjective refraction. And that means that it's just having the person's own opinion as to whether it improves their vision. There are ways of testing for refractive error automatically with what's called a autorefractor, a machine that will measure for refractive error, but that only works in healthy eyes. So if someone has a cataract or a corneal scar or some other problem, it won't be accurate, whereas our system is accurate for anyone.
So you need a digital hub, and that's not an issue in those locations. They still have, but it's offline, so you don't need per se the internet.
Most people have a smartphone. We can supply a smartphone, and they download the app when they have internet, and then they can go and do their work anywhere.
Perfect. Very clever, the offline bit.
And then the app also includes instructions of how to assemble the glasses, and it allows you to input the data of what you've dispensed. And so that allows us again to keep track of inventory. So what we do is supply a kit that has all sorts of lenses you might use. And then as you use them up, we replace what they've used. So the idea is that you always have a full complement of what you might need, but not more than you need. And that you can just replace what you're using so you don't have a lot of money or space tied up in stock that you're not using.
Yeah.
Also, it allows us to know what's going on because we have very little data about what's out there, what refractive error people have and what the improvement in their vision will be. There's very little data, so it's going to help us to know how to proceed as well.
Oh, yeah, there's a paper to be written coming.
Many papers. And also to inform governments and say, okay, well, you can spend this much money on cataract surgery, or you can spend 1/10 of that money and get a 40% improvement in vision in children and working age people or whatever. So
yeah,
there's lots of information we'll be able to collect.
Real world evidence. Perfect.
Yes, exactly.
And so The prototyping, did you do it in Australia? You did the pre-accelerator at UNSW Founder. What was the impact of this accelerator?
Yes, that was really helpful. I met lots of people. Unfortunately, the accelerator program was during COVID, so it was limited what interaction we could have, but I met a lot of really interesting people, very helpful people. It's a great network at UNSW Founders, and I continue to work with them.
And that was in 2020?
Yes, but I'm still working with UNSW Founders. They have a makerspace at the university, so I've done some prototyping down there. The industrial designer I work with is Ed Crowe, and he's designed the glasses. He's designed the testing wheel, and we continue to work with him. He has his own design company, Ed Crowe Design, but he also teaches at UNSW and is involved in Founders. We've partnered with the Medical Device Partnering Program at Flinders. We just got a grant from the Australian National Fabrication Facility in South Australia, and they're helping us to finalize designs for manufacture. We've made lots of connections through UNSW Founders, yes.
Perfect. And in terms of facilities and help for prototyping, was that instrumental?
Absolutely, yeah. The makerspace there has all kinds of machines and people that help guide us. To give you an example, the lenses that we put in the glasses are 40 mil diameter. I needed 30 mil diameter to put within the testing wheel prototypes to test how that would work. So a couple of weeks ago, I went down to Makerspace and I said, can we cut these 40 mil lenses down to 30 mils? Because that would be a lot cheaper than ordering new lenses, which were 30 mil. So they said, yeah, sure, no problem. And they helped me to organize the laser cutter and program it to do that. And then we just cut the 30 mil lenses. Done.
So, and it's not like undercutting quality. They have machines that are great and still work there.
And people who know what they're doing with the programs for the laser cutters and the machines and so on. So they're all very helpful down there.
Yeah.
They've been a great support.
How about the pitching bits, the business bits? Obviously, you were quite informed on how to run a business because you run your own practice. But still, it's a little bit different from running a completely out of the blue business that is not exactly what you say. How did that play out in the accelerator?
Certainly learned a lot through that, but especially after as well, just having to learn about finance and governance. It's quite different from medical practice. The other thing that's very different about medical practice is in our world, the whole system is based on trust. You know, if I'm sharing a patient with another doctor and I exchange information, I just assume I know that what they're telling me is true because there's no reason for it not to be. But in business, it's not so much the case. People want to make money and they will tell you things that aren't exaggerated or not necessarily complete in order to make money. And I find that very frustrating. And even with the investment, like you say, even social impact investors, one of their first questions is, what about my return? How are you going to make money? And I do find that frustrating sometimes, because often those investors are the ones who have more money than they'd ever know what to do with.
Yeah, but their business is return on investment.
Their benchmark of success is their return. I've had to learn to adapt to that and try and work out how we can reach to find a way to make the whole thing financially sustainable and investable while achieving my end goal is to get glasses on as many people's faces as I can.
Mm. Do you know there is a social entrepreneurship university or accelerator program in Oxford, I think, or in the Netherlands, but they are functioning differently and they're not just looking at return on investment. We know that the first question that investors have is return on investment, but if we're talking social impact, do you think there are a group of investors that are looking really for the social impact without focusing too much on the numbers? Or should we put a call out there on those investors? Do you have any network around this investing where we're focusing on the social impact rather than on crude return on investment?
I don't have a network for that. So I do want to reach out to those people. I have to say that LEK Consultants, who's a major management consultant firm, work with Dakota Track Foundation. And when we did our first project, they did an analysis of the economic impact of this system. And they concluded that our eyeglass provision, the return on investment was $91 of economic benefit for every dollar invested. Now, I was told with my pitches and so on, they said, you can't say that because nobody will believe you. People are looking at 5-time impact or 6 times, but 91 is ridiculous.
And yet it's true.
It's true. Yes. Because it allows people to work and study and look after each other and drive and all those things that just make life possible. And it affects young people, working age people, not just old people. It has a lasting impact because the glasses last for years and years. That's the conclusion they came up with. If someone is looking for a return on their investment in terms of impact, you cannot do better than that.
Yeah. But of course, it doesn't translate on return on investment in money. It saves money from the system, but not at the investor level, which I think is where we have the issue, yeah.
But when you present that impact to governments, large organizations, and so on, they are willing then to pay the cost of the system. So we can still make a return on the cost of producing these kits to larger organizations, large hospitals, and so on.
In the developing world or in developed country?
Both. So, for example, India. I traveled to India and I visited 9 hospitals, big hospitals in India. And all the people I met were really keen on the system. Once I described to how it works, and I saw how they're normally doing it in the clinics. They do everything in the traditional way, which is very time consuming and very expensive. And I said, well, you can do it this way and it's going to save you money and it's going to be quicker and so on. And their eyes are popping out of their heads by the time I've described it to them. So they will be willing to pay a decent amount for that system, presumably because they're going to save money in the long run. So that's a way we can get a return on investment.
How about Australia?
In Australia, a great example would be remote Indigenous communities. The way people currently get glasses is the government has a fly-in, fly-out system for optometrists who are sent to regional centers, and Indigenous people can attend and get their eyes checked and get free glasses. In my engagement with Indigenous communities, there is a problem here in that a lot of people don't want to travel to or are unable to travel to regional centers. They prefer to stay on country. And I think that's something we need to respect. Someone might want to stay on country and be willing to compromise a little bit on the style of glasses or the quality, whatever, if they're able to stay where they are and be seen and treated by someone in their own community, like an Aboriginal healthcare worker. So I would like the opportunity to tap into the Indigenous health worker network and just try it and see if people in remote communities find that service helpful. And even knowing that perhaps if they travel to a regional center, they'll get more definitive diagnoses and they'll get full health care. But if they choose not to do that or can't, they can at least have a pair of glasses which allows them to function.
Yeah. Okay. So at the moment they fly in, fly out. And so probably the cost of that for the government is also really high. And of course, it's great that we're trying to give the same access to remote communities. But as you say, I hear that maybe this is not their preference. If there is a choice, that would be quite interesting.
And importantly, I think we need to respect their choice. We can't say this is what you need. You need to get as good quality as we get in the city. No, we need to give them the choice. It's great if we can fly them into a regional center or they can travel by bus to get a full eye health check. But if they choose not to, they could still be able to get glasses in their community.
Yeah, so you could train those over 2,000 healthcare workers from their own community to go and travel around this way.
Yes. I'll give you an example of that, if you like. My husband and I were traveling around Arnhem Land, and we spent a day with an Indigenous fellow who was our guide, and he took us all around his country for the whole day. And I noticed that he was having trouble reading. He was having trouble with his vision. And I got to know him during the course of the day because it was just a small group. And at the end of the day, I said, Neville, you seem to be having some trouble with your vision. And he said, yeah, I do. I think I probably need some glasses. And I said, yeah, why haven't you got glasses? And he said he lives in Darwin half the time and travels back and forth to Arnhem Land. And I said to him, how would you get glasses if you wanted them? And he said, I would go in Darwin. There are optometrists. I can go there and I can get free glasses, have my eyes tested. And all the time he was telling me this, he was gazing off into the distance, bit disinterested. And I said, why haven't you? And he didn't really have an answer. And I said, what if an Indigenous health worker in Jabiru, which is this town in Arnhem Land, what if the Aboriginal health worker there could get you glasses? And he looked at me and he said, oh, that'd be good. So
yeah,
it was a completely different reaction to being, yeah, I could go to an optometrist, but that's never going to happen.
Yes, it's a cultural barrier there also on top of a technical barrier.
Yeah. It was a cultural thing. I just didn't feel comfortable walking into an optometry shop and being tested. This is Neville. I sent him a pair of glasses and a letter. Can you see that?
Yeah, I can see that. Oh my gosh, that's so good.
I sent him his glasses and he was very happy.
So you had to buy in from Neville and then he's wearing the OOXI glasses. So he much preferred that even though he could have gone to Darwin and to an optometrist.
Absolutely.
Point made.
Yes. And I think that is the whole point, is even though he had accessibility, easy accessibility and free glasses, he didn't partake in that because he didn't feel comfortable.
Yeah. So you have to understand the context.
Yeah. It's cultural safety is the catch cry. Feeling comfortable.
Yeah.
I lived in Africa for a while and it is, I mean, obviously a completely different situation with me and my white privilege, but living in a place where you're so visibly different and you walk into a pub or a shop, everyone turns, here's a white person. And you can just tell this white person is rich or they're this or they're that. And it's just so tiresome, so tiresome. You just want to blend in. So even though, like I said, mine is a fraction, I get a feel for what it must be like to just not feel comfortable walking into someone's white optometry shop and asking for glasses and maybe them thinking that you're very smart or whatever. I don't know.
Yeah, understood. Okay, so more advocacy with the government and see if simple, low-cost solution, but still effective with a 90% return on impact investment would interest them.
Yes.
Okay, what's in the name?
We started out with the name 4Eyes Vision because obviously 4 eyes is glasses. We're getting glasses and so on. But then as we started to expand to other countries and started to look at getting trademarks and IP protection, people said, oh, 4 eyes is a derogatory term. So in other countries, they didn't really understand the Australian sense of humor. Who gives a crap told me that they have to look at their name in other countries as well because some people think that's offensive. So it's ridiculous, but we have to acknowledge that. So we had to try and come up with a name that was unique. A domain name was available and a trademark was available and so on and so on. And everything with vision, glasses, sight, they're all taken. So we thought, okay, we have to come up with a word that's made up. And that's how we came up with this word, which is the double O represents the glasses. The X is multiplying the power of the eyes, double I. Glasses on eyes.
So very mathematical analogy. I love it. I love a good name.
And we were lucky to find that no one else had the OOXI name. So
yeah, always a difficulty one. I hear that a lot. Beautiful name. And it rings pretty nice. OOXI. I like it. The OOXI Global.
Yeah, it's friendly. It's cheerful. I should mention the foundation associated with OOXI is still called Four Eyes Vision Foundation.
What was the reason to set up a foundation on top of a for-profit business?
I was advised to keep the IP separate, which most foundations do. Also, the main purpose for doing it is we were trying to become financially viable and sustainable. And by having a foot in both camps, if you like, is that we are eligible for charitable donations to help get glasses to the neediest communities. But we're also, with the for-profit entity, we're also eligible for government funding for entrepreneurship and manufacturing, developing, and so on. So the idea is that OOXI supplies the foundation at cost with our kits, and any profit we make by selling glasses in the developing world, so on, 50% of those profits will go to the foundation as well.
Right. So best of both worlds.
So the whole idea is to get the most glasses on the most faces to people who need them, and to make it financially sustainable so that we can keep going and not rely on donations to do every bit of work.
Yeah, it's hard. It's hard if you rely on your donation.
Yes. I was inspired by the book, The Happiest Man on Earth is the story of Eddie, a Holocaust survivor. And in one part of the book, he talks about when he was released from the concentration camp, the war ended, and he arrived in Belgium. And he and his friend were lined up, at a charity waiting for some food or clothes. And the line was so long and they were standing there for ages. And he said to his friend, look, forget this, let's go off and try and find a job. And that inspired me to say, we'll look for donations for our foundation, but let's go and try and make a way to move forward without relying on charity.
Yeah, because money is power. That's all it is.
Yeah.
Unfortunately, that's how it works. Yeah. Awesome. What a great story. I want to ask you though, what is the most costly mistake that you have done and what is your proudest moment?
The costliest mistake I think I have made, and I have made many, is trusting people in business, perhaps more than I should have. And I've learned that even if someone seems like the best person in the world, you have to make sure you have I's dotted and T's crossed to make sure that power is shared appropriately, that there are checks and balances and audits to make sure people are doing what they say they're going to do. And just being careful to make sure things are done correctly, even when it's someone you think is your best buddy and your trusted friend. You have to be careful in business.
I see. So I'm hearing that even though you might have your own judgment on someone's character, sometimes business might change this later on in an agenda maybe is not as clear as it seems it was. So having processes and system in place to prevent power to be distributed wrongly. Very good advice for business founders, especially there is a lot of people trying to do co-founders and initially you're overwhelmed and you're thinking, I'm just going to do that with someone else and it's going to be helpful. And it can be helpful, but it can make or break.
Yes. And if you choose the wrong person or you choose someone you think is right and it turns out that they're not what you thought, it's very difficult to unravel that.
Yeah.
So you have to be careful at the beginning. And if you're able to do it by yourself without a co-founder, I think it's better.
I don't want to undermine the co-founder thing because it can be a very powerful thing. And we've heard very good story about that. But I think is what you say, you need to know the person very well and understand their full agenda and their full character development, which is a lot to ask for a co-founder.
And it takes time. So often you have to start slowly with a temporary agreement to see how things go.
Yeah. There's a lot of brands that separate later. So Eden and Ice is one great story to listen to for anyone there.
I think there's an important message for young women, particularly. I think there's a lot of pressure on women to do everything before they have kids and put off kids until everything is settled and they're established in their career and they've done all the qualifications. But that's absolutely not true. And I'm an example of having kids all the way through along the way. It wasn't easy, but it worked. And here I am. All my children have grown up and left home, and I still have a good decade or two to work on my startup. So there is life after children and during children.
Yeah, so we can take our time, and there's no point in wanting to achieve everything before you're 30.
Yeah.
I love it.
You asked me to pick a song. Marley, don't worry about a thing, because every little thing's going to be all right.
That was Dr. Sarah Crowe, the founder of OOXI Global. What a powerhouse. Just an academic path was enough to get me impressed. But then adding medicine, then the exam for ophthalmology, all while having 4 kids is even more impressive. And I'm so grateful that she shared his early career time as a junior doctor in South Africa, reminding us of the ugly truth of colonization with real raw examples on how it played out. Another great message on Sarah's tale is that not everything has to happen before you're 30 or even 40. There's lots of pressure for young people to excel, and social media is certainly feeding the anxiety. And look, I talk to a lot of young stars, and that's fantastic, but it's also fine to build your expertise, your family if you desire one, and make opportunity happen later. When Sarah went to the Solomon Islands and found her aha moment where she thought, we've got to do something about this, her kids had left the home, and she was a well-seasoned professional with multiple experiences in launching clinical practices with a load of lessons and mistakes. Now, her business model is both great and tricky. Dual model of business whose profit is enabling social impact through a foundation or other partners has proven successful. Who Gives a Crap has donated $6 million profit back in 2020. So clearly, the combination of a very simple product like toilet paper or glasses with higher margin in developed countries and social impact can make significant profit. The genius of OOXI is having simplified the entire process around accessing glasses, empowering nurses to evaluate eyesight assisted by an app, removing the bottleneck around the shortage of ophthalmologists, especially in remote locations, and simplifying the glass design to very cool, yet durable and adaptable. The tricky part is convincing investors that 90% saving on the whole process and in saving the opportunity cost associated with poor vision translates in return on investment for them. But it can. And for government, they should definitely jump on this straight away. This is a great way of making more with less. Luckily, Sarah is beyond border and she already has a global plan to tap into countries like India who would benefit from the system and could afford the whole price. Watch this space, and I hope to get Sarah back on the show for more of her entrepreneurial endeavors because she's got some more in stock and we only had an hour. Hey, thanks for listening. If you like the show, share it. Tune in for monthly episodes. You can follow multiple hats, visit my website. That's angeliquegreco.com.au. Or follow me on LinkedIn or Twitter. Just search for Angelique Greco. I'd love to hear from you. If you want to tell me about your story, leave me a message.